I may have the coolest job in the entire world. I talk with executives from the American healthcare industry all day, every day, and help build management teams across the entire continuum of care, across all 50 states. So the perspective is huge and the variety of work is fascinating. But there are few segments within the American healthcare industry where I'm especially passionate. If you've ever been to my office or if you know me, you know that I'm not someone who chooses to live amongst the people. A rural lifestyle fits me very well. So I always love an opportunity to work with rural healthcare providers. And that brings me to today's guest. I've seen people do rural health well. I've seen them do it poorly. The overwhelming majority, they just fight to meet the regulatory standards set out by the federal government. Garen Carpenter is the CEO of Van Buren County Hospital. He is leading a team of people who are reimagining rural health care. What they're doing to elevate quality in every facet of patient care, the way they communicate with one another, the way they serve the community, it's truly exceptional. Let's go meet Garen.
You are now listening to the Stark Lane podcast.
So rural healthcare for you, is that a passion or is this something that you had planned for your career?
That's an interesting question, Ryan. When I went into healthcare, I really didn't know where I wanted to go. And having grown up in rural Iowa, right, Northeast Iowa, it was a part of my roots. When I got into healthcare, my first role as a higher level administrator was at the University of Iowa Hospitals and Clinics, right? So academic medical center. I enjoyed it there. We were serving the people of Iowa, and many of those were folks from rural areas. So I saw the value in that, and I saw where I connected with that or intersected with that, but never really had that plan to say, hey, I'm going to stay in academic medicine or be in a critical access hospital. I did when I was going through my MHA program. I had done my internship at a critical access hospital in Northeast Iowa, from around the area that I grew up in, and I thoroughly enjoyed that, and I used that experience, to sharpen some of my skills and understanding of what was going on. And I always looked at that as a great opportunity when I was at the U to say, hey, here's what's going on in these rural places. How can we, as an academic medical center, really think about those that we are serving and perhaps approach things differently or better serve them, whether it's related to access or the experience or the communication with rural facilities, whatever that may be. So, I don't know that is rural healthcare a passion? Absolutely. Again, these are that we're serving the people that I grew up with. Right. I can relate to them. I understand where they're coming from. And, there's a passion there. But I also can see myself, just being a passionate person I am about that patient experience and really my why of why I'm in healthcare to begin with, serving everywhere or anywhere I can. But I love it here. I love what we're doing. And we have great momentum.
We've known each other for over 2 years. And every time we talk, I'm wondering how you found yourself in a critical access hospital after growing up in an academic medical center. So Thank you for that explanation. That is so cool how you melded both of those worlds because, and I think you'll probably agree, there are very few polar opposites like an academic medical center and a critical access hospital in an area that's an independent, right?
Yeah.
Just so totally different from a resource perspective, from a service area perspective. So let's double back and talk about a critical access hospital. What is a critical access hospital? So everybody can know what that is and what you do.
Yeah, so I'll do my very best to explain that. But what a critical access hospital is really a designation. It's a designation from CMS that really says, okay, You serve an area that's underserved. There's some parameters around that. You have to be 25 miles from another facility. Again, it has to be underserved. And it's really was a mechanism that was put in place decades ago to support rural facilities, support rural hospitals to ensure that rural people of America maintain that access to care.
Okay, so going back to that designation, what Garen's explaining is that the federal government says we're going to give you a special sort of allocation to serve this rural area where there is no other hospital care for this population of people who live out in this area. And when he's talking about reimbursement, the federal government these days with hospitals and physicians, generally there's a prospective payment system, and they say, we're going to give you $1 for this particular code. And that's what they do for most hospitals. But in a critical access, they look at what you are spending to provide care for these patients, and they reimburse you based on that. So realistically, that could be a good thing, but it's still a paper thin margin, just paper thin.
Again, and it all you're absolutely right, Ryan, and a lot of it depends upon the percent of Medicare, Medicaid that you do have accessing services. To your perspective payment system, right? All of our other commercial payers, we still follow that. We have contracts with these payers, and regardless of what we charge, we get paid what they say we're going to get paid. So again, with all of that, margins still are thin, and we have to be very diligent with the resources and our approach to sustainability because of that.
This is where we get into the part of this episode that I'm super excited about. Garen Carpenter in Van Buren County Hospital. This guy that came from academic medical centers and who is bringing some of the best practices of those big academic medical centers as it relates to quality and continuous quality improvement and culture to a rural hospital environment that is independent, purely independent. You have an affiliation, but your bank account comes from what you're paid by Medicare and your payers on that paper thin margin. So instead of reacting to regulatory compliance, you and your team are still so passionately proactive about elevating the care experience and the quality of care you deliver to your people. So, how and why do you do that? I mean, that's tough.
Ryan, it really comes down to, you're right. There's a lot of passion on our team. And a few years back when we were developing our culture, or at the beginning of our culture journey, we developed a why statement, right? And we did that organizationally with all of our impact staff and leaders. Why do we do what we do? And a common theme is, hey, we serve our friends, our families, and our neighbors, right? So I think that's where a lot of that compassion comes from. But it's critical. We have four big dot goals here at VBCH, Ryan. It's intended outcomes, one, culture, access to care, and the last one is sustainability. We are dedicated and committed to ensuring that this small gem in a small critical access hospital, or in a small community, we're here for many years to come. Our community deserves that, and we want to ensure that, again, we're being really good stewards of the resources we do have to ensure that does happen. So what drives it? It's really passion, but passion for the community that we love.
As CEO, and I'm not, throwing compliments at you, but you really have to be kind of fearless, and you have to have a good solid vision, because right now there's sort of a playbook for critical access hospitals. They're having a hard time making it. They can't make payroll, so they convert to rural emergency hospital, and then eventually they either sell to a larger institution that can use them just as a referral source to their main hospitals, or they close altogether. But you are fearlessly going the other direction. You're staying independent, you're serving your community. You seem to be doing it well and it seems to be paying off.
Yeah.
So what advice would you have to other CEOs who are in similar environments
Yeah.
who are, sort of facing that struggle?
Ryan, I think a lot of how we're approaching it all starts with mindset, right? Mindset is really sets the trajectory of anything that we do in life, and oftentimes, what we hear about VBCH or Van Buren County, right? We're situated in Keosauqua. It's a town of 800 people. Van Buren County is right around 7,200, right? So we're in a small community, and oftentimes what we hear from our people of the community is, hey, we're so lucky to have you here. uh, uh, you know, many communities don't have this type of organization in their community, and I think that's fantastic. I love it. I love that we have loyal patients, we have a loyal community to our hospital, but sometimes I believe that can lead to small mindedness thinking, right?
Yeah.
So I want to
Hmm.
take that gratitude, I want to take that appreciation for what the community has for us and say, hang on, how can we use that small as our superpower? How can we do things differently? How can we reimagine what rural healthcare looks like? And that's part of that why statement as well. And it's really that why statement, that reimagining rural healthcare, because we know we have to be different. We know we cannot be the same as we were yesterday, and we best be better tomorrow if we want to survive in this tough healthcare industry with where things are going.
You know, you brought you brought up so many awesome points there, and I would like to speak to every one of them individually, but the big glaring question is you've got a town of 800 people and you're running a hospital full of people with highly specialized skills. And you need people with those highly specialized skills to deliver care to people with highly specialized needs. And so
Mhm.
when you're walking down the hall and you see somebody doing something wrong, you can't say, "Hey, idiot, come over here. You're fired," because you can't just like go over to Main Street and pick up a new person, right?
That's right.
So and recruiting, like recruiting people from other areas is another challenge because if you pull someone out of Chicago, the staying power is, I don't know, 50-50 at best. So
Mhm.
how do you handle that talent pool perspective?
Oh, Ryan, there's so many levers to that one. And if we talk about looking at how is academic medicine different than a critical access hospital or
That's a
rural
good lens to
space.
approach. Let's approach that question through that lens. That's a great
Yeah,
way to look at this.
I
Yeah.
think if one, there's so much of similarities between, we all have a mission to serve, provide high quality care, great experience, et cetera. So there is a lot alike. But one of the key differences is that in a rural hospital, you're right, resources are different.
Mhm.
When I was at the U and working in an administrative capacity there, right? If I needed something done or help with strategic planning, there was a group for that. Project management group for that, right? If you were looking for government relations, there was a group for that. All of these different groups and resources that you can go to in a critical access hospital, you wear all those hats. So that's one aspect that's very different. But the recruitment, then, speaking
Mhm.
to just recruitment of providers or impact staff, right? That's probably one of the biggest differences that we have. So oftentimes what we see is it's not only the hospital that has to be impressive and having a culture in which they want to work in, but also the community. Is it a community they want to live in? Right. So some of our
Mhm.
recruitment goes much wider. Oftentimes at the U, when we were recruiting for a specialized position, within a week, we'd have several dozen of well qualified candidates. And the hard part is selecting which one would be best
Mhm.
in a rural hospital. you're lucky to get one.
Mhm.
And so then the strategy becomes, and what we're really starting to work towards as part of our culture is, hey, if we're not able to recruit those, because a small community,
Mhm.
there's only so many people with the skills you're looking for or have had that training, is hire people with the heart. Hire people with the heart, and then be intentional about the development programs you have within your hospital to develop them. And again, that's kind of a journey we're just starting on. We're recognizing, hang on a second, we need to start doing better at this as part of our culture, building succession plans because recruitment is hard. But that's a piece of it.
And speaking of recruitment, let's also go to the talent management side of the equation because the way you manage those people is a little different as well because you can't just go pull someone off a shelf and put them in, to the game in the same quarter, if you will.
Yep. Yep. And what's really different about what we have, Ryan, is, small community. Oftentimes, many of our managers have grown up through the system, right? So they were a good nurse, they're going to make a good nurse manager or whatever it is, whatever department you want to talk about. And oftentimes, all of a sudden, we find leaders in positions where now they're holding what used to be colleagues or the same level accountable for their actions. So that's definitely a complexity that we have to work through, but also, right, if we have to have a hard conversation with one of our employees that day, hey, guess what? That night, our kids run together in a track meet, and we're going to be in the stands together. Right. It's a really interesting dynamic that we have to work through. And it's not like we had in a larger academic medical center where you could have those hard conversations, walk away, and that's it. Oftentimes, a lot of these team players, they went to high school together, right?
Hmm.
It's they go to church together, and they're constantly intersecting not only in the hospital but on the outside. So just another complexity that we have to manage with our leaders and our teams.
The accountability in a small town is so different. I mean,
Mhm.
you're lucky to have one grocery store,
Yeah,
one or two restaurants, and then you will see those people everywhere. There,
yeah,
you probably have some sort of professional relationship with the spouse of that person that works for you at another institution because there aren't a lot of institutions in town.
mhm,
Whereas, if you
mhm,
work in a major academic medical center in Chicago, Des Moines, whatever the case may be, uh, you have five or six grocery stores in town. You have countless restaurants. You don't live in that same tight community where you're so accountable for every word that you deliver in the hallway of a hospital. It's just an interesting dynamic. I find it fascinating.
It is very interesting. And just this morning, Ryan, right? I go to the local convenience store to get a cup of coffee. I find myself in a 20-minute conversation with a community member about why are some critical access hospitals closing? What's the reason to that? What are we doing here to minimize that risk? And this happens all the time. Providers go to the grocery store, patients, want to interact with them. So you are absolutely right. Just a different dynamic.
Other than being a major economic hub, you're also a social hub because in Keosauqua, are there any employers that are larger than the hospital? I mean, I would
I
say
believe
very
the
few.
one I there's three larger ones, and I say large with bunny ears or quotations. The school, we do have a school district in Keosauqua that serves the entire county, and then a manufacturing. Those are the three largest.
So you're
Other
a big part of the community. You can't hide from that.
care doesn't just happen within our four walls. right? Care, just as much of creating value in people's lives as it relates to their healthcare, happens outside of our walls. So one thing that we're doing a lot of too, to your point, how visible we are in the community, is going out into the community and having community conversations, just going to coffee shops and talking about their experience and how we can do better, going out and doing education. So even going out and volunteering at track meets, or serving popcorn at the concession stand. So we're super involved in our community, our leaders. That's the expectation, because that's our way to give back, but it's also a way to create that relationship and a sense of trust, right? Your patients need to trust who you are as an organization, the care you have. So being very intentional about that. But it's not the hospital and then the community. All of it just blends together.
So one thing I love about what you're doing with Van Buren County Hospital is you're not just a place to go fix yourself when you're broken. You have a lot of proactive measures to elevate the health and quality of life of your community too, right?
Yes. Yeah, I think, there's a lot that what we're doing, Ryan, and one thing that we started here in the last few years, we started a complex care program that it started out using some HRSA grants to get it going. We actually, as part of that complex care program, we actually initiated the Southeast Iowa Complex Care Network, where it's a four-county region of different hospitals coming together, hospice, whatever it may be, different organizations coming together at the table and saying, okay, let's take our competition hats off and let's say, how do we better serve these patients that have complex needs? Right? How can we serve within the region, and do a better job at that? So that's been one innovative thing that we've started doing. We work really, really hard at ensuring that we have specialists here. As we talked about a little earlier, access to care is one of our big dot goals. And part of that is, we know the further a patient has to travel for care, the less likely they're going to go to seek out that
Hmm.
care. So
Absolutely.
we work really hard to ensure we have specialists come to Keosauqua, to come to Van Buren Hospital, to ensure that we can have those, that our patients can see specialists here. Now, it might only be once or twice a month, right? But at least we have that access to care. So that's another element we're working really, really hard on, and ensuring that access to care is right here in their hometown, because we see it every day. If they have to go outside of the county, many times, especially with transportation being such an issue for so many in our county, it's not going to happen. So we have to do our due diligence to ensure that they can get it right here.
So what is the next chapter for VBCH?
Continue to improve, Ryan. I think when we first started this journey that we've been on, the first couple years of in my role as CEO here, I've been here going on about 6 years now. It was really kind of gauging what's going on, where's our strengths, where's our opportunities, et cetera. But as we, thinking about that next phase that kind of started a couple years ago, really one approach that I took to set up a strategy, set up that vision with how we're going to approach things. Back when I was at the university, I went through a master's program in Dartmouth. And one thing that really stuck with me, a professor, his name was William Joyce. He had written a paper called "What Really Matters," and what that paper really talked about was, they went to 200 successful organizations, I'm sure in all different industries, and said,
Mhm.
"What do you need to be successful? What is it you need to be successful?" And what they come out of that was, they call it the 4+2 model, but there were four things that I really have focused on to say, okay, are those four things they come up with? What are those four things that we need to do really well to be successful? And it was strategy, culture, structure, and execution. And so, based on that study, if you get those things right, there's a good chance you're going to be successful. So that's one thing that's kind of been our roadmap to say, okay, culture. We've spent a lot of time on culture. It's not just a flavor of the month here at VBCH. It's something we talk about daily. We have a culture playbook that we use to really guide our. It's a set of standards. It's not only how we behave or act, but how we do things, right? That's what culture is. So we've spent a lot of time on that and have been very intentional about that. In terms of strategy, it's something that we have taken more seriously, especially in this last cycle. And sometimes, looking at the strategy, I was just talking with one of the leaders yesterday. It's not that it's might not look like a typical strategic plan for a hospital,
Hmm.
but in the analysis and what we wanted to do, we recognize, okay, we got to press pause and maybe get back to some basic blocking and tackling before we want to be throwing the Hail Marys all the time, right? There's nothing wrong sometimes with 3 yards and a cloud of dust, right? Let's get the basics. Let's build the basics, start there, that foundation, and then we'll throw some Hail Marys in there, flea flickers, right? And go after those bigger things. So strategy, that's where we've started. And I anticipate these first 3 years in this cycle, we're going to build those foundational things. And then in the next cycle, that's when we're going to start. Okay, let's start putting a dent in what we're doing in terms of, additional growth or additional ideas. And then we have structure. I think that's one thing that we had done in the and that's how I met you, Ryan, was in
Hmm.
that structure change. We went ahead, and one thing that we wanted to do, we understand quality is so important, and we say it, but were we doing it? And I think that was one when in our last strategic plan cycle, it was very clear that we had opportunity there and we needed to fix it. And what we wanted to do is set up a structure where we could put more muscle in quality
Hmm.
and better align our departments so that those that interacted, they could build systems amongst each other which then impact the outcomes for our patients, not only their health outcomes, but their experience. So structure's been very important and a big change we've made here at VBCH. That position we're talking about is the Chief Clinical and Quality Officer.
Hmm.
And that's someone you helped recruit and doing a great job. And we're starting to see a shift in how we're doing things and bringing that mindset. And that role really was just, what was it, Ryan? It was kind of a mix of a COO, CNO with some extra quality experience, right? That's really all it was. But I think now that we've made that alignment, brought that position in, we're starting to see some things form, which is exciting. And then, of course, execution, that's the last one. It really takes a culture, strategy, and structure to really execute on things and build those systems in which we can do what we do, our mission, and achieve that vision that we've set out for. That was a
Now,
long-winded answer to your question, but there's a lot that plays into that.
so that makes so much sense. That four pillar framework you were talking about. Now, what you were doing and what you do from the outside looking in is so profound and so radically different, for the average person to observe. Because when you talk about quality in healthcare, generally speaking, you're talking about the feds. The CMS says you have to meet these standards in this area, and healthcare quality is all about meeting those standards and passing surveys. But for you and VBCH, when you talk about quality, you're talking about literally doing everything better, from patient experience to the way people talk to one another, to the way you facilitate care and the impression you leave. Oh, sorry, phone ringing. And so when you look at it through the framework of those four pillars, now I totally get it. I think about, oh gosh, I think it was Robin Sharma. I read a lot of his books years ago, and I think it was him that said, tidal waves of innovation come from tiny little improvements on a daily basis.
Yeah.
You don't just radically change things. If you really want to make an impact, you make tiny little improvements in different areas every day. And you guys seem to be doing that in every facet of care and communication and everything you do.
Yeah. Yeah, Ryan, it's something, those quality indicators that the feds look at, or, we compare ourselves a lot against our network, other affiliates in the network that we're affiliated with in terms of outcomes, and what those outcomes are. But to your point, that's important, right? Because that measures our performance, how well we're doing.
Mm-hmm.
But what is more important, and it's very key, is that process to get there. What happens in between your baseline measure and that final outcome? That's what really matters. And sometimes as leaders, that's something that I've grown into, always those outcomes. What are the numbers, right? And that's where
Mm-hmm.
we get focus on, but it matters. But what happens in between is the most important thing. A great example is we're working on a specific outcome within our organization over the last year, had a lot of intentions put into it, a lot of focus and time. And, looking at it, we're 10 months in or so, and the number is not where we want to be.
Mm-hmm.
But when I look back at the frameworks we put in place, the intentional effort, being able to understand if what is in our control and influence we are doing, right there, that's a win. It's because we're providing better care as much as we can. Sometimes there's variables that are outside our control and influence, right? But are we
Mm-hmm.
doing our piece? And so much of quality comes from communication, systems, best practices, standardization, all of that. And that's that basic blocking and tackling we're really working on. Because if we do that right, Ryan, the rest will come.
I'll sleep better at night when we have more Garen Carpenters in the American healthcare industry.
Yeah.
I think we need more of that. We need more people like you who are so obsessed with their team and empowering their team to do their best work to take care of the people in their community. I mean, there's
Yeah.
very little consideration for you and your needs and your career. It's all about serving others. And I think that's what healthcare should be all about.
You're absolutely right. And Ryan, it's not just me. I have a team that has the same mindset. And I think one thing that, if you look at the metro or urban type medical centers versus critical, one thing we have to be, and at least our approach is we have to be scrappy
Mm-hmm.
because there's limited resources. We have to get after, we have to think differently. And one thing that we really work on, because it's easy to drift into being leaders and thinking we know, is always come at it from a patient's lens, right? That connects us back to the why. That is why we get after it and do things the way we are. And then with that, also our vision is to reimagine what rural healthcare looks. We can't be the same tomorrow as we are today. We have to be different if we want to survive, and trying to take that proactive approach to what we're doing is extremely critical.
And on that note, it is Friday before Memorial Day weekend. You have patients and employees and leaders to take care of, and I've got to do the same. Garen, thank you so much for joining us today.
Ryan, it's my pleasure. I am extremely honored and humbled that I had the opportunity to have this conversation with you. I hope that you have a blessed weekend and happy Memorial Day.
This has been the Stark Lane podcast. You can find us on YouTube, Spotify, and wherever you find the programs to elevate your career and your passions. Now, get back to work.